I'm Christine Piskarik. I am the veterinarian and medical director at Old Friends Senior Dog Sanctuary.
I'm Abby Nesbitt, and I am the veterinary technician here.
Every day brings something different for us. We don't have a routine day because all of our dogs are older and have different needs. They bring different challenges every single day. And we also have the fosters that are out in homes that we will see several times a week, and that brings different challenges as well. So an average day could involve new dogs coming in from local shelters, evaluating a dog that might be in crisis here, having like an emergency. We may be doing routine things, just monitoring the dogs with blood work, urines, things like that. We may be evaluating to see if we need to reach out to the local hospitals or to the hospitals that offer more extended care for some of our patients, or to seek maybe specialty care, or to get evaluations by the specialists. So
working with old dogs is pretty great. We don't have to deal with puppies, or we don't have to deal with other breeds like dog or cats. So not dealing with cats is pretty great. These old dogs are nice and calm. Most of the time they make pretty good patients, but blood draws and stuff, it's a little bit harder because their veins aren't the best anymore, and so they come in with a lot of problems, but it's nice to see how big of a turnaround we can do with them. Like, they come in very decrepit, and you just don't know what the turnout is going to be with them and how much left they have in them. But like Nikki, she comes in here, and these dogs don't walk, and a few sessions of laser and therapy, they're walking. And it's just amazing to see the turnaround of these guys and how much fight they have in them still.
when we have a dog that comes in here severely neglected, or appears to be on its last legs, it's a challenge, but it's one that is very rewarding for us. And I think that in the medical department, and I think in the whole entire building, the philosophy isn't that these dogs are coming here to die. They're coming here so that we can give them the best life we can, that's remaining. And so how can we do that? What can the medical department do that will enrich their life, that will improve their quality of life, and that will make them more comfortable? And so that's putting together an individual package, looking at each dog when it comes in here from top to bottom, and putting together an individual package that will work for them and adjusting it over time. And to see how much they change, their attitudes, their abilities, just their appearance, whether it's gaining weight or becoming more mobile, that's reward like every day for us. It's just, the
turnaround for these dogs, it's just, we get some of these dogs in, like Paisley, she came in a absolute disaster. Like, you would have thought this dog maybe has a few hours left. And then, we get her skin fixed up, get her a dermatology consult, and now she's in foster, and her coat is just absolutely amazing, and she's gained a lot of weight, and she's getting around. She could barely walk when she came in here, but just the amazing turnaround. She's like a completely new dog. Her attitude has changed so much, and we have so many dogs that come in like that, and just to see their turnaround is just so rewarding.
The new building is going to make a huge difference in how we practice veterinary medicine for the old friends here. Right now, we do have to rely on the local veterinary practices a lot, which can be hard on the dogs here. They're older and they get set in their ways, and some of them have a hard time leaving the building or the sanctuary. But we don't have the capabilities right now to do sterile surgical procedures, things like spays and neuters and tumor removals, that sort of thing. we use either the local hospitals to help us out, or if it's a more advanced procedure, then we'll use one of the specialty hospitals like Nashville Veterinary Specialists. We also don't have x-ray right now, which is huge for these dogs. I mean, we have so many dogs that come in with arthritis or might have like bladder stones, or are heartworm positive and we want to check their heart, and we have to run them back and forth to local veterinary hospitals. That's all things that we're going to be able to do on our own now. So it's just going to be able to allow us to provide way more of the care in one localized place for the dogs, rather than relying so much on the community vets.
Yeah, I mean, the new hospital is just going to bring so much more opportunities for us. We'll probably have a way bigger staff and less transport needed. It's just, I mean, that takes up so much time. You know, we go to the specialist, it takes 30, 45 minutes to get there, going through Nashville traffic, and then you just never know what the traffic is going to be like in Nashville, and you never know how long the appointments are going to take, and that's time I could be here working on these dogs and helping Dr. Christine, but it's time that we're spending at other places, and it'll be nice to have more and more time to spend at the new building and be able to do all those things. So when we get a new dog in, it's we have to decide, you know, if we get 3 dogs in at once, are they coming from the same home? Are they good with other dogs? Does one have kennel cough and one doesn't? It depends on, you know, we have 2 isolation rooms, and these dogs have to stay a period of 7 days in these rooms, and then so in that 7 days we usually find out if they have kennel cough or not.
I think for me, don't feel sorry for yourself. You know, a lot of these dogs come in maybe a little bit for us looking defeated, but they haven't given up. And no matter what their challenges are, whether they're completely blind or missing a leg or, you know, super arthritic, they persevere and they love their lives, you know, and there's no reason to feel sorry for them because they're not feeling sorry for themselves. And I think if we all kind of took that attitude, you know, I think we'd all be a little bit happier in life.
All right, so senior dogs have taught me a lot. Working here, starting, I didn't know what I was going to expect, and so in this past almost 2 years, I've learned a lot. So like she said, senior dogs, they just don't give up. They keep on pushing through the pain. They can come in the most pain in the world, and they just don't give up. They just keep on pushing through, and that's a lesson that I think we could all learn, just to push through the hard times and have patience and knowing that things are going to get better from here. It doesn't matter how bad things were in the past, we just keep moving forward, and that's what they've taught me.